Hello, parents, and welcome to our virtual pediatric campfire chat, brought to you by Crystal Run Healthcare. As pediatricians and parents ourselves, we created this series to open a dialogue to provide education and answers on a variety of topics we know have been weighing on your minds throughout the COVID-19 pandemic. Your Crystal Run pediatrician is a trusted advisor during these difficult times. So sit back, get cozy, and get ready to chat. Well, good evening and welcome parents and Dr. Kumar, Dr. Jangda tonight to our second in our series of campfire chats here at Crystal Run. I'm Dr. John Nasser. I'm on location at Camp Crystal Run. I'm going to introduce our two guests tonight. We have Dr. Kumar, who is at Camp Monroe Crystal Run, and we also have Dr. Jangda. Dr. Jangda is back in the office today. One of us actually had to work today, so he wasn't able to get out yet, but I'm sure he's going to be heading out of the office soon. So welcome again. We're excited to have everyone here. Tonight we're going to be talking about return to camps and daycare during the COVID time. And just wanted to remind everybody that this is a webinar format. It is live TV. So some crazy things sometimes may happen. We're recording this and speaking to you as we go, and so we may have a few technical errors, but we hope that doesn't get in the way. And that also you have the option of submitting questions via the Q&A section on the bottom of your screen. So feel free at any time during our presentation to submit questions to us. And with that, I wanted to introduce our guests and our physicians at Crystal Run. So first we have Dr. Jangda. And Dr. Jangda, I'd love if you could introduce yourself to our parents and patients, to tell us a little bit about yourself. And then I would also ask you to share what you've been doing during the extra shelter at home time over the last few months to take advantage or try out some new things.
Yes, hi, good evening. My name is Dr. Jangda. I'm practicing in this area for the last 23 years. And I've been with Crystal Run for the last almost 9 years now. Before that, I did my training also in New York City. So I've been in New York State for a long time. I got 3 kids, 2 in college, 1 in school, and they taught me a lot, and I'm still learning from them also as well. So, while it's a lockdown, since I have to go to the office and I'm going to the hospital also. So, and with the kids, they were home-based. We were trying to have some, some games at home, like board games, some cards, some outdoor activities like hiking, walking. And so in that way, we were passing our time with the kids. And that's for me.
Great. All right. Thanks. Welcome, Dr. Jangda. And Dr. Kumar, take it away.
Hey guys, so this is Dr. Kumar here. As Dr. Nasser said, I'm one of the pediatricians over at our Monroe office. Similar to Dr. Jangda, I've actually done my training in New York State. I was over at Maria Ferrari Children's Hospital for my training, and have been with Crystal Run for about 4 years now, sort of after my training, now primarily at the Monroe office, like I had mentioned. I have a little bit of catching up to do with Dr. Jangda. I only have 1 child right now. He's a 3-year-old boy. As many of us, hopefully, we've had a little bit more time to spend with our kids during the shelter in place. We've been doing a lot of hiking, having a 3-year-old. It's been fun. I got to teach him how to ride a bike and just trying to sort of learn from him and teach him some new sort of tricks along the way as well. And just kind of trying to enjoy that nice weather outside.
Great. All right. Thanks. So I shared with this, there are some people that I noticed that are here from last week, but I shared last week the 5 most common things that people have been doing during the shelter at home. And so we hit on a few of those, but those in no particular order are gardening, getting creative in the kitchen, picking up a new hobby, exercise, and many of us, I think, have done Zoom happy hours with friends. So just to share that, I think many of you at home have experienced that as well. So before getting into the topic, I just wanted to give an overview of where we are now. I think, as you guys know, at Crystal Run, we have offices in Orange County, Rockland County, and in Sullivan County. And we're sort of in a unique situation here in New York, as I think many of us are kind of watching all over the country as what's been going on. But, you know, I think just to remind all of us, we have come really onto the other side of a really challenging few months. It's hard to believe, but it's actually 3 months ago, almost to the day, that we had our first case at Crystal Run. And we sort of had a peak of activity locally in the beginning of April. At that time, we had 40% of our patients that were being seen for possible COVID testing positive. Fortunately, we've really seen a significant decrease, and I think that's a lot thanks to the hard work of all of you at home who have been being careful and following recommendations about going out. And over the last week now in the 3 counties, we're seeing in the low single digits of new cases, which is certainly reassuring. And along those lines in New York, we are now in the Mid-Hudson region about to move into phase 3 of reopening. So we're certainly in a better place. I think all of us are anxiously watching around the country as cases are increasing and hoping that we can continue to have that good experience here in the New York area. But as we move into phase 3, some realities are happening. One is that the school year has come to an end. So congratulations to anyone who has a graduate. And the second is that a lot of businesses are starting to reopen. And so parents are either going back to work who've been at home, and I think many of you at home have been working from home and managing childcare at the same time, which is certainly challenging. And then the second thing that's happening is that, you know, this is the time as well in terms of going back to work where some alternative may be needed for your kids. So with that in mind, we thought it was a really good topic today to talk about kind of camps and childcare. And so I was going to first start to ask Dr. Jangda to talk about camps. And in particular, I know a lot of parents are asking us recently if it's okay to send their kids to camp and what that might look like. So Aslam, I was just wondering if you could give us an update on where things stand in New York State as far as camps reopening and what safety measures are being recommended if those camps are going to start to welcome children and families back.
All right. Thanks, John. So I will go over with about all the the guidelines and what's going on right now. So we know that the daycares are open for the last few weeks because of the essential workers, and they've been using the daycare. But it's going to be a challenge to open summer camps because of all the things what's going on right now. So, so New York State announced that they will start this. They were, allowed to have a summer camp open end of this month, probably 27 or 28 June, in New York State and in New Jersey in the first week of July. But I heard that the YMCA might open in the first week of July also as well. So it depends how ready they are, how they are comfortable to open up. It's all depend on individual camps, but all those camps are should be accredited by the American Camp Association, which is a nationwide association, and they give guideline and feed to those camps what to do, what not to do. But because of this current situation, what's going on, so the American Camp Association does not have a capacity to make all those guidelines about precautions and all those things. So they hired a third party called Environmental Engineering and Health. So they prepared the guidelines along with the CDC to come up with all those rules and regulations. So this year is going to be a challenge for the summer camps, and also it's going to be for the parents needs to be safe to drop their kids over there. So they should be properly informed and of what they should do and what they shouldn't do. At the same token, there should be an open and communication between the staff, campers, and the parents on a daily basis, just to know what's going on. Now, some of the parents may be not in touch with the staff because of the limitation of getting together. So they might get in touch more on the phone or emails, but there should be an open communication with them. Also, there'll be different rules regarding dropping the kids to the summer camp because the parents might not allowed to go inside. the meals are going to be, maybe it's a box meal rather than, open serving kind of thing. Regarding their payments, how they're going to do it, probably electronic, nothing using the cash or credit card or whatever. Also having definitely having the hand sanitizer and mask with them all the time. Now the precautions or the screening, that's the most important thing, that the staff and the campers, how they're going to get screened. So they have couple of questionnaires, the screening questionnaires. They're going to ask the staff before they start working over there. They're altogether 4. It could be more, but there are 4 basic. One is like whether they have a fever for the last 2 weeks or not. Are they been sick, like fatigue, fever, cough, cold, vomiting, diarrhea, headaches for the last 2 weeks? Or they've been traveled, internationally or nationally in the last 2 weeks. Have they been exposed or possible exposure with the COVID with their friends or families? So they're going to, and maybe the parents will get all those screening questionnaires from the camps also, and the staff also should be screened. Now I have got teenagers in my office the other day, and he was planning to work in the summer camp, and they want him to have a COVID test done. So now, is that necessary to have a COVID test done? It depends on the camp, but I think so. If they are exposed like a week ago, and if you do the COVID test after 5 days, it might be negative. So I think the screening questions has got more weight rather than the testing. But of course, if they want to do the testing for the staff, not for the campers, for the staff, that's fine. And regarding regarding their activities over there, that's another thing. So they will cut down some of their sports activities because of the contact and collision. So they might go with more outdoor activities with kind of non-contact and with distance-wise. So again, it depends on the camps, what comfortable, what activities they're going to offer. But arts and craft, drawing, they have some, other activities that are non-contact. They can do that. Also, what about the indoor and outdoor activities? Of course, outdoor activities are more preferable than indoor. Regarding the wearing the mask, whether they should wear mask all the time when they go inside or indoor activities for any reason, yes, they need to wear mask. And then, but outside, will they wear the mask or not? Again, outdoor active, as long as they're in distance, they're fine, because if they're playing, they're active, sometimes they have a problem with the breathing. So as long as they're in distance, they're fine. Also, now regarding the groups, they want to have a smaller groups now. So they want to have at least like the maximum 10 campers in a group with one staff. And also they want to have one staff in the same group. Before, they used to, the staff was jumping from one group to another group, but just to prevent the exposure, they want to have a minimum exposure to have one staff person to the same group. Also, with the group wise itself, they're not going to be able to go to another group, those like 10 to 20 people group, because they want to have a less exposure. So that's in a nutshell about the camps and stuff. And of course, if they have any questions in the end, they can always ask me.
Yeah, so that's a big nutshell of information. There's a lot to sort of unpack with that. I think maybe what I would just ask is for Dr. Kumar, is I know in looking at the recommendations, and both from CDC and New York State about camps and daycare, they're pretty similar. And as Dr. Jangda mentioned, actually a lot of the daycares have remained open for this entire period of time. In fact, many of our employees have continued to use some local daycares and as essential workers. Can you help us understand how daycares are handling this and what safety measures some of them are following? Are they similar to what Dr. Jangda described? And what can parents expect if they're taking their children back to daycare for the first time?
Yeah, sure. So as far as things in regards to daycare, again, some of our viewers may have some children who've been in daycare this entire time. Of course, for us as healthcare workers, if we had younger children, they were doing the same. Unlike with camps, I'm sure for anyone who's been in daycare, you've kind of realized, as with probably many of us over the last couple of months, what's become the new normal is get ready for things to change, that we have to be adaptable. We have to be sort of somewhat flexible. There's certainly a great degree of overlap in sort of the overall guidelines that Dr. Jangda went over in certainly a bit of detail between daycare and camp. But I think sort of the biggest thing that I tell people is ask questions as things tend to change. Screening guidelines are in place for daycare as well. If you're just starting to return to daycare, it's reasonable to ask, what am I expecting to see when I first get there? Or is there going to be somebody taking my child's temperature? Do I fill out a questionnaire before? There have been a couple methods that have been discussed for screening. Also, what happens if my child or anybody else may be sick? What is the protocol in place? Do we isolate the children, until a parent can pick them up, and in what area? For younger children with daycare, it's reasonable to ask also about toys. Frequently, the answer is going to be don't bring your own toys because we may not be able to clean them, and making sure that maybe that we've been able to sort of comb the rooms to make sure anything that can't be either laundered or put through sort of a soapy sort of water clean has been taken out of the room. Interestingly, as we go through the guidelines, many times we found things like books are considered lower risk. So it's reasonable to ask for some older children what the protocol is on books, and even things like utensils. Should we bring our own utensils? Do children have their own sort of separate utensils as well? Again, talking about younger children, asking about things like, what are we doing for nap times? Currently, the guideline is, if we can, bring our own sort of linens and beddings that are typically going to be separated from sort of all of the other sort of daycare attendees, that can again be washed sort of daily along the way, and expect that, again, as having a 3-year-old, like I mentioned, I kind of know the drill in terms of always making sure there was an extra set of clothes as my son was in preschool, but many times they'll ask maybe another extra set of clothes along the way. And then also sort of what are we doing for younger children with changing stations? Another thing to sort of get in the habit of, this has all been ingrained for all of us at this point, but frequent hand washing. I mean, it does get harder with younger children, but hopefully we've been working at home with them as well, making it hopefully at least somewhat of a routine scheduled experience, if not something that's at least fun for them, and expecting even the caretakers to sort of partake in that, making sure children are washing their hands regularly. As Dr. Jangda had mentioned, outdoor activities are typically considered to be lower risk, even for daycares. We're looking at things like, about 10 people to a room, trying to limit cross coverage to rooms. So asking what happens, if an administrator or a caretaker in the daycare is out, how do you cross cover? Do we have to sort of do something differently? And then, like I said, just being prepared for things to change and unexpected things to happen. If there is a positive case, the idea is that's gonna likely have to be reported to the Department of Health. They would get in touch with the daycare and expect at times that the daycare may have to be closed for a period of even up to 2 to 5 days, just to make sure we can clean all the surfaces, and that making sure that anyone who may have been exposed, we've been able to trace and make sure they're isolated and being monitored appropriately to make sure they don't develop any signs or symptoms as well. I'm sure there's a lot more questions to ask along the way. So certainly I'm happy to sort of, take any of the questions from our viewers, anyone who's had children in daycare and just wants to ask about some of the new changes they've seen, or anyone who's getting ready to send the child back and you kind of want to know what to expect, or what would sort of be meeting the guideline standards. And again, so we're happy to sort of take any questions along the way as well.
Great. I think that's really good advice from both of you, that for parents that are considering a camp or daycare, that the best thing that you can do is to talk to the daycare director or the camp director about how they're implementing the safety recommendations. And if you go to the New York State website, as an example, New York Forward has a publication on the requirements for camp and daycare in terms of all of these things that we just mentioned. And I think the challenge for camps and for daycare is how they actually will implement that. So one question that I did want to ask, maybe this one for Dr. Kumar, for parents as a parent of a 3-year-old, and although it wasn't that long ago that it seems that I had children that age, it's hard enough to get them to potty train. How can parents engage with their children about why they're wearing a mask? And the current recommendations are for anyone over 2 to wear a mask. So do you have any advice for parents of younger children on how they can talk to them about why they're wearing and their need for wearing a mask when they're going, for example, indoors at daycare?
Sure. Yeah, I mean, so talking about it from specifically the daycare perspective, certainly like you had mentioned, it's recommended for all attendees over 2, so long as they don't have any extenuating or special circumstances, to be wearing masks when they are attending. It is not mandated, again, because any of us who've had a child in that age group, even if you get the mask on, it's hard to keep it on. But at home, certainly we've been working on it with our son. I've been able to talk to certain other friends, and look, we're all kind of learning as we go along as well. Certain things that you can do, try to play sort of games where you may dress up as a costume character with a mask on, to try to get children into sort of that mode of realizing maybe it's a little bit more normalized. Getting into sort of situations where if your child is old enough, just even being able to have some discussions about, you don't have to go into a great bit of detail about it. It's not necessarily to scare them, but even talking to them about the fact that, look, some people are sick and we want to make sure that we keep ourselves safe and everybody around us, our friends at daycare, safe. And one of the ways we do that is by trying to keep our masks on as well. One of the tricks, actually, ironically, that was posed to me by a friend of my wife, she had actually very kindly, we call her actually, my son calls her Aunt Casey, and she was nice enough to make a cloth mask which was matching for everyone in the family. So it was a good way to start to get them into sort of that mentality of, look, mommy and daddy are wearing it. You see some more people who start to wear it outside, which tends to help. And then, like I said, having some of these imaginary games that you can play to prep people to get ready for it as well. And hopefully making them feel more comfortable in that way. From, again, the daycare setting, it is useful, again, to, like we said, get more information from the administrators of the daycare in terms of, how strict are they in enforcing it and mandating it? If you feel like your child really won't do well with it, how will that work in that specific setting? Or do we just want to give your child a little bit more time, maybe to practice in the ways that we had talked about and with shorter trips or games in the ways that we had discussed?
Great advice. One follow-up question. What's the best costume character with a mask that you've done with your son?
Yeah, I mean, so lucky for me is that our son is 3, and while I will openly admit we've probably given in a little bit more on screen time since being sort of sheltering at home than we would have prior to this. So somewhat lucky for me is he does not necessarily know a lot of characters, so we were able to make some up. I am sorry, I don't have a great answer for a costume character with a mask from the face down necessarily that tends to work, but I would maybe even rely on some of our viewers that have some older children to maybe give me some advice on that.
All right, we're really honest. If anybody at home wants to submit in our Q&A some great costumes they've done with masks, please do so. So great. Dr. Jangda, one other follow-up question on camps. So I think I've heard this from parents, 2 things about camp that I think if we all went to camp, we probably remember and loved. So one is swimming, and then the other one is sports. So what are camps, what are you hearing about, what have you been seeing about how camps are handling those 2 things, which are a big part of camps, or at least used to be in the pre-COVID days?
All right, so before I give the answer to your question, you were talking about the mask. So I got like 18-month-old in the office 2 days ago, and he was wearing the mask so nicely and quietly and without touching his mask with his hands. And, it was really amazing. It was great. So, so it's not about the age, like 3 years or 2 years. Sometimes they'll learn from the parents, and the parents are keep wearing it. So it's kind of, it's kind of very interesting. As we, sometimes, the age is not a factor. So yeah, so back to your questions about the swimming. So with the water, the great thing about that it does not spread through the water, the coronavirus. So the swimming is safe, yes, and then the chlorine also helps to to clear that virus if there's any. And of course, when you do the swimming, you have to make sure that you're keeping the social distancing, like the other person should be away from your side, so that they don't, breathe on each other, basically. So you have to be careful. There should be a distance about it. And then the other thing you're asking about
Sports. What
sports,
will
yeah.
sports look like?
So the sports wise, of course, as I mentioned before, that if you're talking about the contact or collision sports, that's kind of no at this moment. At the summer camps, they will go with more, like bow and arrow. Basketball is also, they're talking about that, yes, you can play basketball as long as, because they are kind of a little bit away. It's not very close contacts all the time. They are talking about having tracks and running. And tennis is another good sports. Basically, they can do that. So those things are pretty interesting. So that's what my team is.
Great. Yeah, I mean, I've heard from a few of the local sports camps here in our area that I haven't heard specifically that any the sports specific camps and the sports training. I haven't heard that any are specifically opening yet. I know they're all figuring out how to best do this. And I think, what I've been hearing about from some parents and also from some club sports is that, a lot are starting to roll out sports specific drills and practice that are done individually. So I think it's challenging for our kids and families who do play team sports, like basketball, that often do involve kind of up close. Even soccer. But what I've been hearing is that there are programs now that are just working on skills specific to their sport without the close interaction. And I'm certainly listening and watching in the region about sports. I know last week we had some questions about returning to sports, and just again, as a teaser and as a reminder, if you go to our website, Dr. Justin Conway, one of our sports medicine physicians, has posted a blog about return to sports, with both a focus on injury prevention and safety. And we have him planned to come on a future episode here as well to talk about that. So, but I know that's a question we've been hearing about from families about sort of how do we navigate the return to sports. And I think many of our kids are ready to do that. One other question I just wanted to ask for Dr. Kumar, and this also relates to schools opening. And I think this is going to be challenging for us as parents and as frankly as physicians. So if your child gets sick, either with COVID, hopefully not COVID, or a COVID-like illness, like the flu or coughs or colds, what will the time period be before they can return to daycare? Let's take an example where they actually test positive for COVID. When can they go back to school or daycare?
Yeah, I mean, so the answer to this is probably falls into the line of what I was saying, where as we learn more, hopefully we're getting better at sort of getting a sense of a true COVID diagnosis. But the real answer is, again, we've if anyone's been tested or has heard of anyone being tested, we may have many times mentioned, look, a negative test doesn't mean you don't have COVID. We actually don't have a great way with somebody who has COVID type symptoms to completely rule it out just yet. It puts us in an interesting position because thankfully most of our patients, pediatric patients who are otherwise healthy, present with mild symptoms that may reflect something similar to a cold or a cough, or in other cases something more similar to flu. And so as we've sort of learned more about it from the medical standpoint, we've been sort of giving different advice, approaching this with a great deal of caution as we go forward. Tentatively, the current guidelines, from a medical standpoint, would probably be if you have a COVID type illness. Again, you have a child who has a fever, they have a cough or a cold, they're having a sore throat, headache, body aches, things like that. Typically the idea it tends to become is we are really anticipating that they would not be considered to be sort of no longer contagious until at least 10 days after those symptoms have started. And at that 10-day period, we would like to see that they've had no fever for at least 3 days, and that their symptoms overall, especially if they had cough, cold, basically what we would term respiratory symptoms, are improving. Now, again, that's the medical answer. I thankfully had the opportunity to speak to an owner of a local daycare to our area as well. And I think, honestly, the answer from a lot of the daycare and even the schools, once they start to open, some may even be opening for some type of summer programs for school, is really going to be to speak to your physician. And I think that's fair. I think it's fair to not ask them to necessarily have to make this decision on their own, knowing how quickly this data is changing, even for us as we're supposed to be the experts. So tentatively, the real answer is if you have a child with that type of illness, expect for them to be out for a prolonged period of time, possibly over a week for now in reality.
Yeah, and I think that's a big change for parents to think about, in years prior to COVID, even if someone had influenza, we would often return them to school as physicians. We would typically be looking for improved symptoms and fever-free for 24 to 48 hours. Now, their current recommendations for home isolation after COVID infection, as Dr. Kumar mentioned, 10 days. And that's a much different period of time, and certainly going to be challenging for all of us to work through as we think about the combination of for those working and taking care of kids at home. So yeah, thanks for that. I think that's going to be really difficult. So one question that came in from one of the viewers, actually just prior to the meeting, was about teenagers and returning to some socialization this summer. So sort of outside of the scope of camp and daycare, although sometimes I feel like my teenagers need daycare. But I am really interested in this question because both of my teens are asking about this. So maybe Dr. Jangda, I'll start with you on this. What can you tell parents whose kids are noticing that maybe their friends are getting together, or that they're wanting to have more contact or more exposure to their friends who up until now they've been interacting with via this type of setting? So how can parents resume or allow their children to resume some more contact with their friends now that we've moved into this next phase?
So what I would suggest that, of course, it shouldn't be a bigger gathering. It should be like very few kids get together instead of having a large gathering. And the other thing is that it should be outdoor rather than indoor, because outdoor is much better and you have less chances of infection. Also, if the kids are meeting with their friends, the parents should know about their health, that they have been traveled recently, or they've not been sick for the last few weeks, or there is no exposure of any with anyone. So it's a very legitimate question that it's not a bad thing that the kids can ask their friends that all those questions before they meet them, having a play date together. So it's not a bad idea to ask those questions to each other before they hang around. And also keep in mind, when they go outside, they should have the mask. And they should keep using the hand sanitizer and have a good social distance, basically. So those are the things they should keep in mind. Again, right now we are in a good phase right now, since we don't have, because of the lockdown and because of now the phase 2 is coming out. We don't know what will happen in the next few months. So I think so at this moment, those are the cautions that we should have at this moment, and we should be open with our friends about asking those questions. So we should all be safe and sound.
No, I think that's really good advice. I mean, a lot of this for all of us coming back out is sort of a social contract, right? It's about letting others know how we're feeling and not exposing others if we're not feeling our best, and having the trust in those kids and families. Dr. Kumar, anything to add on that about socializing, even for younger kids now? How can parents feel comfortable, or should they feel comfortable seeing other families?
Yeah, so before I get started, I will apologize ahead of time. Like we said, this is a live event, so you may hear some background noise. There's a few people doing some lawn work behind me. If I need to, I'll try to run inside and isolate myself. Yeah, I mean, I agree with sort of everything Dr. Jangda said. Just to again highlight sort of the importance that we had mentioned. Hold on.
Stuff happens sometimes. That's no problem. Last week, as you know, we had an incident with a bear. So this week we've got some lawn activity.
So in the meantime, before since he's getting settled, I just want to add some additional thing about the camps that they're not allowing the sleepover camps right now.
Yes, right.
So I just want to get in touch with them. So to talk about that one. So they don't allow any sleepover camps right now. So everything is going to be a day camp. And also the other safety measure that they are implementing right now is just taking the temperatures of the staff and maybe the campers that are going over there. And actually it's good for the campers and the staff both. When they come in the morning, they should have a temperature, and when they're leaving, they should have a temperature taken. So that's another good measure and tool just to make sure that everyone's safe in that camp.
Great. Munish, yeah, go ahead again. Thanks for relocating. We appreciate that.
Yeah, sorry about that, guys. Yeah, so I was going to say, I completely agree with everything that Dr. Jangda had said as far as, social interaction. I think, as Dr. Nasser had said earlier, a lot of our success in our area really is attributed to all of you at home sort of really following those guidelines that we had put in place in terms of staying home, as much as you can, making sure we're maintaining social distancing, because of all of the sort of positive outcomes we've been seeing, it's true. I think a lot of this kind of comes down to being honest with people, being able to ask people questions, maybe some questions that we didn't feel as comfortable asking in the past, things like, where have you been? Where has your child been over the last few weeks? A lot of it is about sort of, the term that I use, or a term that a lot of us tend to use, is risk mitigation, which a lot of us, talk about in the office. We've been talking about it for years, pretty much ever since all of you have been seeing us. Why we've been always saying, even before all this started, coughing into your sleeve, washing your hands, maybe taking that even a little bit further and saying, maybe planning visits only with not just a small group, but trying to maintain visits with just a small selective group going forward, planning visits, maybe 2 weeks out. So one, you kind of know what everyone has decided to do during those 2 weeks, maybe even further limiting contact with others. But also that hopefully now we have things to look forward to. I know it's been very hard for a lot of children at home, even with a 3-year-old, but certainly I'm sure with those of you who have adolescents at home, who are used to sort of being able to sort of on the spur of the moment, catch up with friends in person, take part in activities, to sort of say, okay, look, it's probably sort of something that needs to be scheduled a little bit more, with a few more questions asked ahead of time. And then, as we had mentioned earlier, generally outdoor activities with a mask are the safest of the options. Indoor activities with increasing numbers of people, you just have to know that there is some increased risk, and hopefully we're all keeping a running dialogue amongst our own contacts in the community. If we're not feeling well, what's going on, just to make sure we're keeping everyone safe.
Okay, great. No, that's great advice. So thanks to both. Last call if there's any questions, but we can get to those, but I just wanted to give a sort of a final remark from both of you. Before doing that, I did notice and want to give a special shout out to my mom, who called in and is in the audience today. So thank you, Mom, for supporting us, and we appreciate you being on the line. And I hope you take something away from this that will be useful to you. And thank you for all of your support of me over all the years. Anyway, so just getting back. So just in conclusion, I'd like to ask you both something we also asked last week. And we can start this time with Dr. Jangda again. So what is your best advice for families and children to maintain their health and wellness during this challenging time of being home and isolated?
So best advice, just to, if you want to have outdoor activities are better, instead of going to somebody's house, keep in mind, mask is very important. Frequent washing of hands is very important. If you're using the soap water, then 20 seconds is very important. Don't be in rush to washing your hands, and social distance. So those are the 3 key things that you need to remember. And then the rest of the things, of course, you have to go with what's going on. As long as you're taking care of all those things, you will be safe with all those germs and infections.
Great. And Dr. Kumar, what advice do you have for families to kind of maintain their well-being, not just around illness, but just other strategies for managing during this time?
Yeah, I mean, I know we've talked a lot about distancing. We've talked a lot about sort of washing hands, all the things that you've all heard for the last 3 months. I mean, I think it's really important at this time where, you know, what's on everyone's mind all the time is COVID, is not to forget the other things that keep us healthy. In fact, many of these things give us a much better chance to do well with most illnesses. So making sure that we're trying to eat a healthy, balanced diet, you know, again, you know, trying to get fresh fruits and vegetables in, staying active. I mean, again, we asked so many people to stay sort of indoors and hunker in, and then we ended up having this surprisingly cold April. You know, again, while that weather is getting nicer, I encourage everyone, please, you know, start getting out, going for walks if you haven't already. You know, we've talked about it in the office many times. You know, try to get 40 to 60 minutes of some kind of physical activity in every day. You know, whether that's just playing outside or you know, doing something like riding a bike. Remember, all of these things do tend to help us to maintain our health, not just in the spectrum of things like infectious sort of diseases, but generally tend to help our own mental health as well. You know, again, we've all been stressed. I'm sure as adults we can all say this. You know, again, it's true for all of our children. We've been seeing them sort of going through this, you know, even seeing probably some of those subtle cues. You know, engage, keep an open conversation at home, and don't forget all the other sort of things that just kind of keep us healthier altogether. And then also one of the things that I stress with all of my patients, I'm sure we all do, is good sleep hygiene. Make sure you guys are getting good sleep as best you can. You know, try to make sure you're getting, you know, for many children, it's closer to 8 to 9 hours of sleep, avoiding screens before you go to bed, things like that as well. You know, all these things that should hopefully help to keep us safe and healthy throughout.
Great. That's great advice. So thanks. So just in closing, I just want to thank Dr. Kumar and Jangda again for joining. And for those at home, just my own input on that last thing is just, you know, a quote that I really like about this time is as follows. You know, this isn't the end. It's not even the beginning of the end, but perhaps it's the end of the beginning. And the reason I bring that up is I know we're all tired and exhausted of this whole process, and it's been a long time already. And on behalf of all of us here, I want to thank all of our patients and families for doing such a good job of really being responsible and helpful and worried about each other and about all of you. And, you know, as we all are excited about this next phase of reopening, want to encourage everyone to continue to do that in a way that's, you know, both sort of wide-eyed and cautious, yet also taking advantage of some additional freedoms. But we still have to be careful. Pay attention locally in your area, what's going on. The cases now are lower, which is good, which reduces the risk of a lot of these things. But it's important for all of you to stay informed about what's going on. And then lastly, if you have questions, ask your pediatrician. Give us a call. We're all happy to talk to you about these issues. We're hearing from a lot of you on a regular basis every day about these questions. They're very common. We can be a good resource for you for that as well. So the fish are biting. We've got to get going and get some dinner. This is a great time of year. We've got such great daylight. I hope all of you get outside tonight. Next week, we have a great show planned. We have Dr. Amy Spoto and Samatha Bagam specifically talking about families with young children. I know Dr. Kumar will be listening in. Advice for helping those families in particular with young children and some of the special strategies and also some of the struggles of helping those families during this time. So thank you all again and have a great night. And we appreciate you taking some time with us, and we look forward to seeing you next week.
Thank you.